AskReddit by Potato. Doctors of Reddit, what is the weirdest thing you've seen while at work? 450 pounds woman bleeding from the belly button, which was obviously a very deep innie. I resorted to a large speculum to visualize then cauterize the bleeding vessel. OMG, I don't know why, but I never realized that the belly button wouldn't extend out when someone gains a lot of weight. Mexican doctor here. Got a call from a patient who wanted me to check on his wife since she had been laying in bed all morning. When I arrived, I could smell rotten eggs and humidity in the room. Open the door and a body lays there, decomposed probably 2-3 weeks, and the stench was strong because the mattress was all soggy due to the body liquids draining all over flesh. I took the poor old man outside and performed quick exploration, finding his left eye is moving uncontrollably and non-respondent to light. We call his family and I give them the news. Turns out he had been an epileptic his whole life but rarely took his treatment accordingly. Most probably he suffered a seizure that made him motor functional, but mentally challenged. One of the saddest cases I've encountered. That night I took a long shower, called my parents to tell them I love them. Had to take the dog in bed just for comfort. 3 months passed before I decided to do house visits again. Now I carry a hazmat mask in the car at any moment. Wow. So he was living with her while she had passed? Like sleeping in the same bed and whatnot? Sorry if this seems like a dumb question, it was just hard to decipher from your comment. 8 inmates from the local jail injected themselves with another inmate's vomit because he'd had his methadone a few minutes before. All injected with the same needle, might I add. I guess the most interesting thing was seeing how quickly injecting vomit can make one septic. From injection to onset of sepsis was remarkably quick. Less than 4 hours. To add insult to injury, one had HIV, 2 had Hep C and the other had Hep B. We didn't bother working out the order of injection and just tested them all. Another story. Someone had a dart and lodged in their brain. 16-year-old was drunk with mates, playing darts. Threw a dart at his friend and got it in his calf muscle. Friend subsequently removed from leg and threw it back at him. Went right through his skull into his parietal lobe. I live in a regional part of Australia. Emergency department never ceases to entertain. Obs, lots of obligatory butt stuff too. Add your friends to the list of things in Australia that will try to kill you. This is a story from my mom, who was an RN for decades as a hospice nurse but worked in a small country hospital for several years when she was just starting out. While this story has a little gore in it, the weird thing is at the end. One day a farmer came in from the field. He was working on a disc tiller and one of the large metal discs fell off onto his head and sliced it open so the grey matter was visible. After he arrived at the ER, they got the guy onto bed and he was fully conscious and talking. They were waiting for the helicopter to come take him to the big hospital that was probably an hour away by ambulance. When the chopper arrived, the farmer sat up in bed so they could transfer him to the stretcher and a small piece of brain tissue fell onto the pillow. My mom pointed it out and the doc just picked it up and threw it in the trash can. Because it was a small hospital and was rural, the same doctor did all the follow-up for the guy after he got home. For the rest of his life he could remember up to New Year's Eve 1961 and then New Year's Day in 1963. All of 1962 was completely erased from his mind as though it had never happened. My mom always wondered if 1962 was in that small piece of brain the doctor threw in the can. Edit. I called my mom to verify this story and I guess that part of it had been modified in my own mind, my personal Mandela effect. I'm leaving the story above so people can see what my mother corrected me about. The guy was barely conscious when arriving, not talking and wide awake. She said it was like he was holding on to consciousness until he realized he was at the hospital and then he was out. He had fractured his skull. Those discs are huge and there was like a flap of it that his scalp was still holding in place, for the most part. The whole hospital seemed to be involved, it being one of the largest traumas they had ever experienced. My mother was one of those given the task of cleaning up the room afterwards, and she said that when she got home my dad, who was squeamish around blood, saw her cleaning her work clothes and passed out. Well, there goes 1962. I'm not a doctor, but I'm a medical assistant and scribe. We once had a patient who was convinced something was wrong with her scalp. She said her scalp was super itchy and dropping sand like rocks constantly. The doctor examined her scalp and it was perfect. No inflammation, no dandruff, a perfectly healthy scalp. He still sent her some topicals for itching and flaking and said that should clear it up. She came back a month later saying it has gotten even worse. Furthermore, she found a very rare disease on Google and told us that's what she has. He re-examined her scalp and it looked great still. He told her that and said, "I'm confident you don't have this, but we can test for it if you want." Patient excitedly asked for it and we did a biopsy along with a lot blood work. 2 weeks later patient comes back in. Blood work is normal and scalp biopsy is normal as well. We thought this would help the patient, but it did not. She asked for him to re-examine her scalp again. Everything looked normal. Finally he asked her if she has ever considered seeing a therapist because we've ruled out any possible scalp issues and this could be symptomatic of a nervous tic. Of course he said it much more professionally than that. She starts getting very angry and demanding another doctor come take a look. There are multiple doctors in the practice and he says of course we'll have one step in just a few minutes. We treated this as a new patient for the other doctor. All I told him was itching scalp. Patient says there is sand falling from her hair. Patient thinks it's disease name, and this is her most recent blood work. When we go in the exam room there are white crystals all over her scalp, the exam chair, and surrounding floor. None of this was there 10 minutes ago. The doctor looks very confused and asks if there is salt on her scalp. She says no, it's from X disease, and adds that the first doctor is a quack. New doctor says, this isn't really what X disease looks like. These granules are way too fine and don't seem to be attached to the scalp in any way. Patient freaks out saying the whole practice is a scam and loudly leaves the building yelling at everyone. We're all pretty sure she poured salt all over her scalp when we left the room to grab another doctor. It was very weird. I hope she is doing better now, but she does not respond to our messages anymore, so it's likely I'll never find out. Munchausen or something? Guy came in with hemorrhoids caused by wiping his ass with tinfoil. Can't have the government tracking what your poop thinks. Not a doctor, but a paramedic. We were in a crazy busy metro system and we get called out for eye pain 9 times out of 10. Calls like these don't really require an emergency room, it'll be like an eyelash in an eye or something. I stride into the house and casually introduce myself and ask what the problem seems to be. The lady turns to me, showing her right eye bulging out about 3x further than it should, and says my eye popped out of my head. This is a new one on me. No trauma, no nothing, just walking around and suddenly pop. Her eyes out of her skull. Holy crow. Lady, let's get you to the ER. Turns out, she had a super dangerous clot called a cavernous sinus thrombosis. Basically, it clogged one of the drainage vessels for the brain and built up back pressure until her eye popped out. The doc said that most patients with her condition were in no state to have a conversation, so it was a marvel that she was up and walking and talking and complaining about her eye. Holding my eyeballs in while reading this comment. Removed 14 pounds of infected flesh from a man's groin including the scrotal sac. He refused to believe he was diabetic but had stepped on a small carpet anchoring nail and didn't feel it. The only time he could figure it happened was when he recapited his house about 10 months prior. The filth from years old carpet got lodged in his foot and coursed up his leg. We saved his testicles at least by sewing them up into his abdomen, but as you can imagine, we only slightly prolonged his ability to need them. Not a doctor. Was a paramedic student in an ER. Oncoming crew came to get me so I could see the patient. If that happened you knew it was a good one. On top of that the crew themselves kept talking about how fucked it was, which could only mean it was pretty bad. Guy working at a dye factory got his hand caught in a mechanical dye press. It was exerting over 1,000 pounds of force for over 5 minutes on his hand. By the time they got it out, it was partially amputated, and I cannot stress this enough, flat as a piece of paper. The 3 middle fingers were just cartoonish looking in how flat they were. The guy could still semi-wiggle what was there and could still definitely move his index and thumb. The surgeons were discussing WTF they were going to do when I was in there. And the general consensus I was getting was nobody knew WTF to do. I saw one of them prepping the guy's wife to see him. And they were just like, IDK, how to say this other than be prepared, it's not good. And be aware this may have changed his life forever. To this day I cannot get over how unreal it looked. Like I legitimately thought it was fake or I wasn't seeing it right. I work with presses. A co-worker had his fingers smooshed by 160 tons of pressure. He said that rolling paper was thicker than what remained of his fingertips. Took him a month before starting coming to work again. And he had to relearn how to write with his other hand. Surgery rotation in 3rd year med school. Stat call from ER about a guy who had lost a vibrator in his rectum. Physical exam. Nat. Palpable vibration noted LLQ abdomen. The vibrator was still on. Patient stated the vibrator had been fully charged prior to use and would last 4 hours. Ultimately, the attending surgeon wanted to avoid surgery due to the still on vibrator leading to potential complications. The residents made the surgical intern manually pull it out to avoid surgery. Intern ended up getting it out along with a couple of hotel-sized shampoo bottles. Patient discharged home from ER in stable and improved condition. That's why butt toys have a flared base. Practice safe butt stuff. Not a doc but was a medical researcher for a stretch. A homeless guy came in complaining of foot pain. He hadn't taken his boots off for 18 months. DR took one off, turned it upside down and a toe fell out. His toe, or just a random toe? Honestly, so many things that I wouldn't even bat an eye at anymore, but people in the general public always get a kick out of things like shaving cream can up ass, mechanical pencil up penis, a metal ring stuck around penis, and the emergency department didn't actually have the equipment to cut it off, so a jeweler was called. Plastic baggie of drugs up ass. Someone who had a fetish for self-amputating their penis. Someone was stabbed with their guts hanging out by a friend, but the friend was there, and they were cool with each other. Said they just got into a heated argument. Dudes were from a rougher town. Actually, I think I was exposed to quite a bit in my medical training now that I think about it. Self-amputation of penis? So, did you try to sew it back on? Nurse here, a guy who let his dog lick his diabetic ulcer on his foot because the dog liked it. He got a nasty infection, led to sepsis. Nurse here. My supervisor, also a nurse at a clinic, was convinced that dogs' saliva healed wounds because they are always licking theirs and they heal fast. She would purposefully lead her dogs to lick the wounds of everyone in her family. Not me, but a doctor friend. Woman came into the ER with a blanket over her. Everyone assumed she was breastfeeding a baby. Turned out everyone was right except it was a raccoon. Alright. That made me raise my eyebrows. Patient came in with worsening lower limb ulcers and had been dressing them himself. Very poor social circumstances, poor self-care. The stench was bad enough before the homemade dressings even came off, the kind of smell that sticks to everything. Once the dressings were taken down and the worst of the fumes were released, we hoped it was uphill from there. We were wrong. On closer inspection of the wounds, it somehow seemed it was moving. Tiny yellow maggots. Hundreds of them, dipping in and out of the flesh. Sterile maggots can be used therapeutically in certain cases to debride dead tissue, but there was absolutely nothing sterile about this. One of the nurses took it upon herself to go at the legs with the tweezers and seemed to enjoy the never-ending game of reverse whack-a-mole. I left her to it. He got better. God bless that morbidly entertained nurse and her endless helpfulness. During my internship, a person in casually shared that he had been drinking sanitizer for past 3 months. Yeah, chronic alcoholics are famous for this. A very obese woman not realizing she was pregnant. That's not unusual or weird really. The part that's weird was that she put it together that she must have gotten pregnant from her husband's birthday where she surprised him with sex. She had her neighbor's proper legs open with a board and she waited in bed like that for him to come home. That's actually pretty sad. Maggots all over a dude's leg. I'm not talking about a few, like the amount you see on a decaying body. You can hear the noise and the waves of movement from all the maggots. Anyway, the guy codes after paramedics drop him off so we do CPR. Except maggots are flying everywhere now. The smell, oh my goodness, I will never forget the smell. Housekeeping had to go in with biohazard suits to clean up that area of the emergency department and we couldn't use it for a few days. Had a similar thing happen to me in the ER. Medics brought this homeless dude in after he hadn't moved from the same spot lying on a bench for several days. He had been just pissing on himself and shitting himself so he smelled absolutely horrendous by the time he got to us. The second he was brought into the ER the whole ER reeked. My charge nurse said he needs to go straight to the deck and shower so we all gown up ready to spray this dude down. I go in first and I start stripping all his clothes off. The dude's hair looked like it was wriggling because there were so many lice in his hair and his beard. I then take his shoes off, but when I started peeling his socks off his socks were sloughing off skin with them. I peeled his socks off and the whole top part of the skin covering his foot peeled off to exposing all the tendons and bones in his feet. As soon as that happened tons of maggot. Not a doctor but used to work in the OR. Had a guy come in with stomach bowel issues. He was pretty young so it was concerning. Opened him up and found a toothpick sideways in his bowel causing blockage. He had no idea when he ate something with a toothpick. I know a guy that passed from complications of eating a small toothpick in a club sandwich. Serious. I'm not a doctor but my stepmom is one of the nurses that go to old people house and one time she walked in on a old person orgy when she got a notification her heart rate spiked. This is weird but a lot nicer than most of the stories in here.